Hello everyone out there. We all have seen that almost all doctors wear white coats while they are on duty, and this is happening from a long time. Now, doctors have their identities with these white coats. Before late 19th century, the doctors used to wear black coats. The black color symbolized their solemnity also. It is good for hiding stains, dirt, and it doesn't look dirty easily. At that time, people used to think that most medical cures were just little more than a quackery, and the appearance of physician is merely a sign of painful death. In 19th century, scientists who worked in the laboratories used to wear lab coats, and they had harmed the reputation of physicians by showing that the treatment by drugs was useless. Because of it, the doctors were declared guilty, and at the same time, the scientists were praised by the public. The doctor or physicians at that time were not much trusted. As a result, the medical profession turned to science, and the doctors or physicians decided to become a scientist. They wanted to present themselves as scientists, and so they adopted these scientific laboratory coats as the standard of their clothes to portray themselves as a clean, safe source of authority in the new and improved medical field to restore public trust. There were some other reasons too, like in 1890s viruses were discovered, and the germs theory quickly led to the identification of actual organisms that cause many diseases. So, to wear a black coat to hide stains was not an option anymore, and thus the iconic doctor's white coat was born. White color represents purity and shows the commitment made by the physicians to do no harm. In addition, white represents goodness. This is how doctors adopted wearing white coat. But there are still some doctors that don't use them. The psychiatrist. Psychiatrists choose not to wear white coat to make a relation with patients. Patients can be shy, emotional, or may hesitate to openly talk on things like depression, suicide, if the doctor is formally dressed, because sometimes making a connection is difficult if you feel someone different from you. This is called white coat syndrome, where patients may feel rise in blood pressure due to anxiety from the sight of the white coat. There are cases when patients' blood pressure measured at hospital is more than when measured at their home due to hospital environment and the sight of medical staff. So, now you know why most doctors wear white coat and why psychiatrists don't use them. Thank you for watching.